Hi, Dr. Ledis here again, and I wanted to show you another interesting case that is simple but real helpful for people that lose individual teeth and want permanent replacement. So I'm going to kind of go over a case of a single tooth implant replacement on a gentleman. I could show you the models and the lab work, and then when he comes in I'll show you the placement in the mouth. Here we have two working models of the patient. This is the lower jaw, and I could just demonstrate and show you that the missing tooth was where it says number 19, the first molar on one side, and he was missing a tooth on, we'll call that number 30, his first molar on the other side. This model represents this post, as you can see here, where that actually is an analog of the implant post, which I'll show you shortly. If I zoom in on these three components, I could explain what we're looking at. Obviously, the one on the right is a little tiny gold screw that will retain over here this titanium custom fabricated abutment. You'll see the number 19 scribed on that. This actually slips into the implant body itself, which is in the patient's jaw. And then we have a solid zirconia porcelain crown, which ultimately will get cemented on top of the titanium abutment. So we have three pieces that we're going to be utilizing here. So this titanium abutment piece is actually represented in the model here as a analog of that. And then what happens is this gold screw will be placed in the center of this analog and screwed into the dental implant, which I'll demonstrate in the mouth. So really, if I take this solid tooth, it would be in turns placed and cemented onto that abutment on the model in the mouth. So you can see how once it's in place, you don't see any of the titanium, and it just looks like a single individual tooth. You can zoom in, you can see how that looks. So holding the model in my hands, you can see, well, this patient is missing actually a tooth opposing the porcelain number 19. But if I rotate it, he also has number 30, which is the first molar replaced in that area there. So you can see how that fits together, and I could kind of have the luxury of showing you inside the mouth how the tooth fits in the area there. So this is a great way to replace single teeth permanently. These are not removable and they function like normal natural teeth. So what I'll do is I'll show you these placed in the patient's mouth when he comes in, and then we'll take it from there. So here we are in the mouth, and what we're looking at is the little titanium protective cover screw that's over the dental implant. And what I'm going to do is I'm going to remove this and take this off. It's attached by a little small set screw that's in the middle. So let's take this off, and then we will try in the other pieces. So here we are using a little driver, unscrewing the little set screw to remove the little cover screw. And I use a little hemostat to pop this off. See, here we place the titanium abutment and we're tightening the little gold screw. Now we're going to get an x-ray to make sure this looks great. And here is a x-ray of the little titanium abutment that we just placed onto the dental implant to verify that it's seated properly. Now we're going to go back into the mouth and seat the porcelain crown. Now we're going to tighten the little gold screw with this torque driver. And you hear a little click, and that just torques it down to the specifications we need. And I usually place in this little Teflon tape into the little access hole or screw hole that we call this to protect a little screw head from cement, so in case we ever need to retrieve it. And just to show, this is the solid zirconia crown that we adjusted the contacts on, and it slips over the little abutment and then gets cemented on just like that in the mouth. Now we're going to place the crown filled with the cement and cement it on top of the titanium abutment here. Wiggle it down. Okay, bite down. Tap, tap. Good. Open. And here is an x-ray of the other side of his mouth showing the titanium post in place to verify the proper position and fit. And here we have an image of the lower right crown in place. And I could, if you hold the mirror real quick like this, pulling this cheek down, I'll zoom in. And that's a full zirconia crown replacing this tooth here on the dental implant, and the other one on the other side. And you can bite down, tap tap, and that completes the case. Bite down. So that case came out pretty well, looked pretty good. Hopefully that was interesting to see. That case kind of takes around 3 to 4 months for the dental implants to integrate into the jawbone, and about another 3 to 4 weeks to fabricate those full zirconia porcelain crowns. And everything looked pretty good. I think the patient was happy. Worked out well.